Over the last 5 to 10 years, multiple novel therapies have been FDA approved for solid organ and hematologic cancers. The medical management of these medications during the perioperative period differs as with each medication. My name is Jonathan Morris. I'm an orthopedic oncologist at the Emory School of Medicine, and I'm presenting on the perioperative management of systemic cancer therapies for solid organ and hematologic malignancies. Recommendations from the Emory University Systemic Therapies Perioperative Management Group. The manuscript will be appearing in Mayo Clinic Proceedings in March 2026. The purpose of this manuscript was to review the perioperative side effects and then offer recommendations based on the half-lives of the medications to help manage these medications for patients in the perioperative time period undergoing elective surgery. The procedures used were a modified Delphi analysis that allowed for the recommendations from surgeons, pharmacists, and perioperative internists to make recommendations. When final recommendations were made, they were summarized throughout the manuscript. This manuscript offers not just physicians, but also the patients an opportunity to understand what their side effects of these medications may be. And as it's stated in the manuscript, it is very important and imperative for patients to notify the physician if they are taking any of these medications, as the timeline for taking these medications can be years. It might not be an obvious piece of information to include to the physician. The purpose and goal of this research was to further clarify the management of these medications. Additionally, our goal is to help facilitate patients to be on the appropriate medications and maximize their benefit throughout their treatment period, even in the setting of surgery, so that this way they will continue to have the systemic relief from their oncologic malady. The next steps in research for this topic are going to be to start to review the medications that patients are on that have undergone emergent and elective procedures to determine how often their medical management after surgery was altered as a result of these medications. The goal is to revise and refine these recommendations to once again provide as much time period on the medications to allow patients to receive those benefits. It is expected that in the future, as new medications are added, this manuscript will be updated to include these medications. In conclusion, I would like to invite you to read the manuscript and feel free to message or contact us with any questions concerning how this may personally affect you or your patients. We look forward to continued conversations on the topic.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research. published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.